Welcome back. The Health Justice Initiative wants to know how government will ensure the COVID-19 vaccine will be available to anyone who will need it. Now, the organization has written to the Health Department, to COCTA, as well as the National Disaster Management Center. It wants to know whether there is a plan for equitable distribution of a vaccine once one is finalized. The head of the HJI, Fatima Hassan, joins us now for more on this. Fatima, thanks for your time. What are some of the concerns that you raise in your letter regarding the expected timelines around this vaccine?
Thank you. So I think the first concern is that we live in a country with an unequal health system, and we're certainly expecting global shortages, very high prices, and limited supplies. And so we really want to understand from government if they're planning ahead of time, so that if a successful vaccine candidate comes to the market in the next 12 to 18 months, that there's one plan for our country to make sure that there's equitable allocation across both private and public health sectors, to make sure that those people who are most in need and populations are at greatest risk are at the front of the queue. Because we certainly, are concerned that we don't want to repeat what we had with ARVs and HIV/AIDS, where if you were rich, you were able to get treatment first, and if you were poor, you would be last in line.
Now, with that being said, has government responded to your letter?
So we're grateful that government has acknowledged our correspondence, and we are awaiting a more detailed reply. As you know, we've asked several questions. And really, I think the idea is that we don't want to be adversarial, we don't want to be antagonistic, but there's great anxiety in South Africa and elsewhere in the global south. We've seen many wealthier countries stepping ahead of the queue, using a lot of their money and their power and their clout to negotiate bilateral deals directly with some of these drug companies. As you know, there's over 200 vaccine candidates in the pipeline. Some of them are indicating some early promising results. There are also voluntary initiatives where there's pooling mechanisms. So basically what has happened is that the global north, or really rich, wealthy, high-income countries, have bought up hundreds of millions of dosages of potential vaccine candidates, basically leaving the global south with some of the leftovers. So we really do expect that when a vaccine does come and is registered for use in South Africa, there's going to be really hard decisions around rationing. And we believe the public needs to be engaged in a consultation process right now, so that when we do have supplies coming into South Africa, we are able to make sure that the allocation is fair, is reasonable, is equitable, basically. The president has signed on to something called the People's Vaccine, which basically recognizes that a vaccine should go to everyone, everywhere who needs it in the world. So we certainly have a global equity problem, and we're concerned about how that will play out locally here in South Africa too.
Fatima, what's important for government as well as South Africans to note? Should we miss, not only the deadline in acquiring the vaccine, but also if there is a shortage of vaccines in South Africa?
So I think, there's so many global political issues that are playing out at these multilateral institutions. And what we're seeing is that a lot of governments in the global south have basically lost their ability to assert their authority as sovereign states. What we have is very large multinational drug companies who are basically deciding access for the whole world. They're deciding pricing. They're deciding how they're going to exercise their patent monopolies. If there are going to be shortages, I really do believe personally that it's because of profiteering agendas and because of greed, where drug companies who could bring a successful candidate to market are not opening up their licensing, are not opening up technology transfer, are not opening up the ability of other manufacturers to make copies of the vaccine or generic versions through what we call voluntary licensing agreements, where drug companies are determining, for how long a no-profit or a low-profit price will last. In some cases, journalists have uncovered agreements which shows that by mid of 2021, some drug companies will be declaring the pandemic over. So there's certainly a lot of global power issues that are playing out, but that doesn't mean that the South African government cannot play a greater leadership role in Africa, in the global south, assert its authority, fix our own patent laws here in South Africa, fix our own medicine pricing framework here in South Africa, so that if there comes a time where we have to challenge the high prices of vaccines in South Africa, then certainly we would have the legislative framework to do so.
All right, Fatima, we have to leave there. Thank you so much for talking to us.